I'm Callum Rodia in Sudbury, where a conference exploring LGBTQ healthcare issues is underway.
CTV News at 6 with Brendan Connor and Marina Moore.
Welcome back. A conference underway in Sudbury is bringing over 300 healthcare professionals together. They'll be exploring the obstacles and barriers facing the LGBTQ community and looking at strategies to help break them down. CTV's Callum Rodia reports.
In many parts of the north, accessing even basic health care like a family doctor can be challenging. For members of the LGBTQ community, the obstacles can be far greater.
For many people, it's a very challenging experience to find a healthcare provider, particularly in smaller communities, who are either LGBTQ themselves or are really comfortable, confident, and knowledgeable in working with LGBTQ populations.
This three-day conference brings together healthcare providers, researchers, and policymakers to explore and hopefully reduce those obstacles.
No matter what the health issue, there's probably some unique issues for LGBT populations around that, whether that's around eating disorders or teen pregnancy or mental health and addictions or end-of-life concerns.
This nurse practitioner has focused on transgender care for the past 7 years.
One of my very first clients decided that they wanted to be the opposite gender. They were transgender. They came out as trans to me. And I realized at that time I had absolutely no idea what to do, where to go, what resources we had.
Barnett says there still remains many challenges for trans patients in the region.
Finding a competent healthcare provider and one that has been educated well within LGBT care is difficult, as well as one that's able to prescribe and comfortable with prescribing hormones, recommending surgeries.
This is the largest conference of its kind in Canada. Sudbury was chosen because of its close proximity to rural communities, where organizers say LGBTQ barriers to healthcare are much more pronounced. Callum Rodia, CTV News, Sudbury.